Hello and good day, everybody. It's my pleasure to be with you all virtually to present at the International Conference on Computer Science and Information Technology today. The title of my presentation is Teleconsultation for Medical Doctors. My name is Jerron Tesoro. I'm an undergraduate student in Far Eastern University in the Philippines, and I'm joined here today with my co-authors, Paul Castelltort, Bryan Opulencia, and Rain Louise Oliver. With the advent of the COVID-19 pandemic, everybody's lives were turned upside down. In the case of the Philippines, the COVID situation has arguably been resolved, but there have been multiple resurgences in the past months. But in general, it's a downward declining slope. In a developing country like the Philippines, where our economy and technology are far behind technological giants abroad, a drop in economy is increasingly felt. There's been massive unemployment throughout the nation, and to this day, many lower-class citizens either have no work or are working well beneath their previous pay grade. Past resurgences of COVID-19 were rumored to be aided by the stubbornness of certain individuals who did not heed COVID regulations. Until now, such stubbornness is present still in certain areas in the Philippines. Hospitals still give priority to patients afflicted with COVID, and with the pandemic, there came lack of medical resources, hospital beds, and workforce. So patients with other concerns had difficulty getting the help they seek. Now, with this in mind, me and my co-authors sought a client in the medical sector to assist in lightening their burden in these trying times. So the client we have partnered with is Gold Care Multi-Specialty Clinic. They're a patient-oriented quality healthcare service with doctors who specialize in various fields such as pediatrics, obstetrics, gynecology, internal medicine, general and minimally invasive surgery, and otolaryngologists or ENT. The issue that the clinic faces is that because they normally receive their patient bookings out of their Facebook page, Facebook's notification feature fails to alert them in time in many cases. Besides the unreliable booking via social media, the only other way would be to get a walk-in consultation. When me and my co-authors spoke with the doctors of the clinic, who also co-owned the establishment, we determined these issues that they were facing and what we could do to help. Thus, the system that we set out to create had the following objectives. Firstly, we had to design a web-based consultation system where the doctors and patients could safely communicate as an alternative to in-visit consultation. These consultations aimed to provide efficient evaluations that were not life-threatening situations. Secondly, we wanted to develop an inventory system that stores information about their medical resources and that would phase out their old pen and paper approach and digitalize their work process flow day to day. The system would implement simple analytics by means of a sentiment analysis model, which will be present after calls and appointments as a measure for improvement in various aspects of their operations. Lastly, the system would be evaluated with a FERPS model. So now the system, it's meant to cater to the client's needs, but it isn't infallible. With that in mind, the system is comprised of the following. There's a registration feature, naturally, where patients enter their credentials into the system to successfully create an account. There's a booking scheduling feature, where patients choose a date and time for booking. The system will validate the booked schedule to avoid conflicting bookings. After that, it will recommend doctors available for patients who don't know their condition, or the patient is free to choose their own doctor if it's not their first visit and they know who they're looking for. Next, there was a notifications feature where reminders will be alerting the doctor and patient concerning appointments. A patient management records and patient diagnosis records feature will also be present, wherein both doctor and patient respectively will be able to record information concerning a patient's condition. The patient management records feature is accessed by the doctor side, where information received in the consultation is noted down for future consultations. On the other hand, the patient diagnosis records is meant as a way for patients to enter further symptoms or issues that arise to be examined at the next schedule. Moving on, there's doctor management and medical evaluation. So patients are guaranteed professional evaluations. Communication, which embodies the teleconsultation aspect, will naturally be present as well, for doctor and patient to conveniently consult via video calling. A report sprint function also exists, where simple data is recorded: how many patient consultations were made in a day, age and gender range of patients, common afflictions, as well as the busiest time ranges within the day. There's a dashboard that displays various information such as amount of medical resources in stock, among other things, and the amount of staff and patients currently stored within the system database. A pricing feature will be present in the system, showcasing the rates of consultation for each practitioner. Lastly, there's the payments feature, where GCash is the provided mode of payment through online transactions. A no payment or no consultation process is enabled. Therefore, the system must validate payment before patients consult. A cancellation and refund is also not present, but patients have the leeway of rescheduling up to 2 hours before the allotted appointment. Moving on, there are two things the system cannot cater to. First is the consultation for life-threatening situations. The doctors are not equipped to assist patients in this situation, and the system would likely only be a hindrance. Patients like this must seek medical attention at the nearest hospital immediately. Secondly, the doctor availability on client's premise. Patients who do not have a booked schedule at a certain time will not take precedence over an in-visit patient who comes in at the same time. Doctors cannot refuse the said patients, so those who take lesser precedence will be in queue. Our methodology begins with a feasibility analysis. Our requirements analysis was first performed, where we interview and examine the clinic firsthand from personal visits and speaking to the owners and practitioners within the clinic. The data that's gathered will then be used to formulate solutions and point toward the development of the system that is now in implementation. After this, there's an operational feasibility check. The system we've implemented helps doctors tend to their patients remotely and provides patients with convenient access to healthcare with a decrease in geographical obstacles. Documentation such as e-prescriptions or e-certificates are also provided by the system. Next, there's a technical feasibility check. The web-based system was created with Adobe Photoshop, PHP, PHP Admin, XAMPP, MySQL, JavaScript, Popper.js, jQuery, HTML, CSS, and Bootstrap. As shown in the image, these are the minimum requirements for a computer to run the system without flaws. Following that is the scheduled feasibility. If you look at the picture in the slide, this is the developmental cycle of our system development. In August 2021, we looked for a client in the health sector. From September up to the first 3 weeks of November, we did the first 3 chapters of our paper with a mock defense in the last week of November. From January 2022 to April 2022, we did the designing, building, and testing of the system, and once again had a project defense in the last week of April. From May to June 2022, it was spent for the user testing and user review, where we devised a user evaluation individually for the 3 sides of the system: the patient side, the doctor side, and the admin side. All of these will be expounded upon in the following slides. Finally, we had our last touches and final defense in July, and in August, we began implementing the system, which brings us to today. Last but not least is an economic feasibility check. Me and my co-authors have noted down both quantifiable tangible benefits and non-quantifiable intangible benefits. For the tangible benefits, firstly, the system cuts patient costs for time and travel expenses. The system's convenience of remote healthcare alleviates this as well. Doctors are able to secure higher profits because the system allows more patients to seek healthcare due to the lack of needing for physical exertion. A higher referral rate is also present because the system helps to link patients and doctors online in an easy manner. As for the intangible benefits, the system provides fast and easy access to healthcare and allows more patients to seek it because of lack of geographical barriers. It reduces patients' no-shows because of how easy it is to use and reduces risks posed by patient traffic in the clinic. Lastly, and arguably the most important, made so because of the COVID pandemic, the system decreases exposure to different contagions in the clinic because of its online setting. So the picture below shows the system's use case diagram. As seen in the image, patients have access to registration, login, their personal patient diagnosis records, payment, booking and scheduling, and lastly, the notifications. Doctors, on the other hand, have access to logins, patient diagnosis records of their patients, and notifications. Lastly, the admin has access to all the modules because of their role being the rear support for the clinic and the system. This next diagram shows the registration process flow for patients. Upon entering username and password, input validation occurs, and if it's successful, the user proceeds to the dashboard, where they have access to features including consulting a doctor, requesting e-lab, e-prescriptions, e-medical certificates, patient records, plans, and pricing. Finally, this flowchart illustrates the patient diagnosis process flow of the system. While patients can add to or view their records, only a system admin can delete the records. So as for our methodology, the one that we've chosen to use in development is Scrum. Because of online classes being bachelor students, differing free times, living far away from one another, me and my co-authors determined that Scrum would be our most efficient methodology. Through multiple sprints supported by communication online, we made the best use of the time that we were provided. Now we move on into how our finished system is to be evaluated. We executed a convenient sampling technique in choosing our respondents. This allowed anybody with the time to experience the system, which benefited us due to the fast and easy data collection. And it also makes sense because the average user would be the most prominent users of the system. We created a survey wherein, after navigating the system and testing out its features one by one, our respondents would then answer questions regarding the system, keeping in mind the FERPS model. Each segment of the FERPS evaluation was split into 3 further sections, one for the patient side of the system, another for the doctor side of the system, and lastly, one for the admin side of the system. After gathering a total number of 39 respondents, we tallied the results of the survey and applied the weighted mean formula to get the averages. For the ranking of the averages, we used the Likert scale below to separate the answers into 5 separate ranges. These are the results. So in this diagram, we see that across all 3 sides of the system, with each segment of the FERPS model, the weighted mean of the responses from the survey averaged at the 4.0 to the 4.99 mark, which verbally translates to agree. Further, getting the averages of each section together results in this next diagram, where once again the weighted mean of the responses average at 4.0 to 4.99, which again verbally translates to the agree range. Averaging out each segment of the FERPS evaluation marks, we are left with 4.636, the upper range of the agree range in our Likert scale. This shows that the respondents who have user tested the system have deemed it fundamentally usable and easy to navigate and ready for implementation. So in closing, allow me to touch upon once again the COVID situation in the Philippines. While recent resurgences are in decline, a resurgence in the future is not impossible, especially with how COVID variants pop up every now and again. The clinic we have partnered with, Gold Care Multi-Specialty Clinic, struggled with their customer management because of both the COVID pandemic affecting the lives of everyone and the inefficiency of Facebook and social media notifications in general, in notifying them in time concerning appointment schedules and such. Because the doctors of the clinic who double as the owners of the clinic have tenures at other hospitals, they are not always available as they operate the clinic in their spare time. When faced with these issues, me and my co-authors developed a system that has web consultation capabilities, along with an inventory system so as to computerize their workflow and shelf their inefficient and slow pen-paper approach. That's their words, not mine. In developing this system, we have successfully provided a safe and easy approach to healthcare for the clinic, conveniently allowing for remote consultations and other medical processes in the online setting. Engaging the system's effectiveness, a user survey of 39 respondents was successfully executed, and the results were satisfactory, with the final average verbally translated into the agree rating. In essence, the completed system a completed system rather, is indeed efficient and useful to the client. In completing the said system, me and my co-authors have accomplished what we have set out to do. So if you wish for a copy of our original documentation, you can contact any of us authors at the following contact details. I wish everyone else presenting today a successful presentation, and I wish you all a good day. Thank you all for listening.